Hey, I'm Dr. Selene Parekh, a foot and ankle surgeon at Rothman Orthopaedics. I've always been interested in emerging technologies, things that are going to move the needle for patient care. I have been involved in 3D printing from its early use in foot and ankle about 10 years ago. Personalized medicine is what we can deliver with 3D printing. We can use 3D printing to do surgeries that we typically do, like an ankle replacement. We can use 3D printing to give patients a custom or personalized implant if they're a candidate for it. If you're a patient who had a nickel allergy, back in the day, you wouldn't be able to get an implant at all. No metal implant could be used. Now with 3D printing, if you by chance have a nickel allergy, we can 3D print an entire titanium implant and give you something that's 3D printed, purely titanium, both sides of the joint. If you're a patient who has an aluminum allergy, which is in all these metals, we can pivot and give you the non-metal plastic implant that allows you to still have motion, still get pain relief. You don't have to live with your problem. You're coming into a future that's close to now where you can get custom implants that are personalized to your anatomy, that can help address issues like if you already have a joint replacement like a hip or knee or ankle replacement and that has failed, you now have options because we can recreate bones with these 3D printed implants. That's how these 3D printing and non-metal options are changing the game.